Good day everyone, this is Paolo C. Donayre, a second year BPEd student, and today I will be going to discuss the rationale of physical education and health education in K-12 curriculum. First, let me discuss to you the nature of physical education. Nature of physical education, it is a subject in which directly applicable and important to life of a learner in school, post-school, and beyond. It is important for the learner because they are not just going to school to learn but also to become healthy. It is also enhances human development and success through physical activity. It is often involved in informal activities like playing or engaging physical activity than formal lessons in school. With this, learners will know to socialize with the people from his or her surroundings and be able to boost or improve their self-confidence when facing other people. It is also an instrument for health and well-being that can encourage personal responsibility and power over healthy lifestyle. And it is where physical education is an environment where physical activity is respected and incorporated in everyday life. An instrument in the sense that physical education taught us physical activities and abilities to become healthy, not just when you are as a learner, but also you can use it for a long life. There are three primary actions, and these are the individual, social, and inclusive. Individual acknowledges that people are involved for all skills of reasons like work, playing, challenge, accomplishment, health, personal growth, reflection, relaxation, artistic, cultural expression, and social interaction. With this, you will enable to improve yourself and also to socialize with other people. Next will be the social. Social acknowledges our choices and opportunities for involvement that are influenced by the society or what we see in our surroundings. So next is the inclusive, provides essential ways to express who we are as an individual or groups. It is the right of individual to do physical education no matter who and what you are. So you can do physical education despite of the diversity you have as a student or learners. Of health education. There is a need of health education because it provides us good, reliable, and valid health information that would be tackled in schools and that could help us in preventing disease. So the need of health education is very important. It is where we will be knowledgeable enough on how to take care of our body and health, on what the food we should take, and also the minerals or the vitamins that has in that food. Legal basis of physical education. According to Article 1 of the International Charter of Physical Education and Sports, UNESCO Paris 1878, and Recommendation 1, Interdisciplinary Regional Meeting of Experts in Physical Education and Sports, UNESCO Brisbane 1982 states that practice of physical education and sports is a fundamental right for all. So the practice for physical education and sports is for everybody. So it is our right to learn what is the importance of physical education and what is the importance of engaging in sports or any physical activity. And the right should not be treated as different in principle from the right of adequate food, shelter, and Medicare. Article 14, Section 19 of the 1987 Constitution of the Republic of the Philippines states that the state shall promote physical education and encourage sports program, league, competitions, and amateur sports, including training for international competition to foster self-discipline, teamwork, and excellence for the development of a healthy citizenry. So with this, in this article, in Region 8, we have this called IBRAA, or the Eastern Visayas Regional Athletic Association, where all athletes is will be compete, and the winner will go and compete for the palarong pambansa. And this is one of the example of sports program. And engaging in sports, you can build teamwork, and your discipline will be also improved. And all educational institutions shall undertake regular sports activities through the country in cooperation with athletic clubs and other agencies. So in school, we have this called intramurals. So it is an educational institution, and that intramurals is one of the sports program also, or sports activities that this article is implemented. Feature of health education. Health education is being implemented to K-12 because we need to learn that in our body we need to be responsible of taking of nutritious food that has vitamins, minerals, or any that could give goodness in our body, and that we could prevent having diseases or any sickness that we could have when we engage in eating much more of unhealthy foods. So the nature of health education is more on healthy lifestyle, more on giving knowledge about the importance of our health. Need of physical education. There is a need of physical education in our country today, and a need to be discussed in schools, because mostly of the people who get diseases, viruses, and illnesses are those people who are not knowledgeable enough and don't know the importance of physical education, as well as engaging physical activities or being physically inactive. To lessen this problem, physical education is a must to be taught in school. According to the estimates of WHO, or the World Health Organization in Western Pacific region, 65% of total deaths among Filipinos in the year 2000 and 72% in 2012 were due to non-communicable diseases. Also, in 2008, the Food and Nutrition Research Institute reported that 86% of Filipino high school students in Manila failed to achieve the recommended physical activity level, to which we need to work our body for 60 minutes, and that is the minimum level of it. The need is clear: implementing physical education program to teach youngsters how to live an active and healthy lifestyle to avoid non-communicable diseases which are related to an individual. So it is very important to learn or to be taught the need of physical education, for it will help us avoid illnesses, sickness, and viruses. Most especially that we are in the midst of pandemic, and we are experiencing having this COVID-19 virus. Aims of physical education. The aim of physical education is to give students knowledge, ideas, and learnings on how important physical education and engaging in physical activities in our life and as a student. Physical education could help students improve their body physically, or in the other sense, they are taught on how to become physically literate. Students are also taught on the tenet that is on how to move, so they could learn on how to move. So, the aim of physical education is to give students knowledge and on how important our body is, and how important engaging sports or any physical activities. Aims of health education. The aim of health education is to give students idea on how to live a healthier life that could help them to live a longer life and help them become aware of the things that they need to take or eat for their body to be healthy. And it aims to give knowledge into how very important individuals' health is, because health is wealth. Physical education and health education is very important and should be taught or implemented in school. Engaging physical activities is a way for us to have a healthy body, and by that we can avoid diseases, viruses, and any other illnesses that will try to destroy our immune system.